Hello, my name is Ashley. I attend Muskegon Community College. I'm enrolled in History 202 with Professor Troutman. For my midterm project, I chose to research the history of chemo and radiation therapy in the early 1900s and the progress we have made with how we use chemo and radiation therapy today. In the early 1900s, if you were diagnosed with any kind of cancer, it was a death sentence. This meant you would become very sick and eventually die from cancer. Today, we have learned to pinpoint specific types of cancer cells and kill these cells while keeping the normal cells healthy. I'm going to share with you some of the progress we have made through science and technology to get where we are today with cancer treatment. In the blue, you can see what the normal cells look like. They are smooth, have a much regular circular border, a small circular nuclei there in the center. The cancer cells have an irregular border and have almost like an elevated expression is what they call it here of certain cell markers, which is like the little spiky parts around the border of the cancer cell. The nuclei also is irregular shape and much larger. And the cancer cells will divide and rapidly and multiply, and that's how cancer spreads. Chemo and radiation therapy are most common treatment options for cancer today. It has not always been this way. In the early 1900s, there was no treatment. In the 1920s, surgery was just about the only option for cancer. If you didn't have a visible tumor that could be surgically removed, then your cancer was just not treatable. Radiation became an option in the 1930s when cancer became more common. It could be used to help treat most cancers except for blood cancers such as leukemia. This brought on more thoughts of how we can kill the cancer and many more types of cancer. Well, in the 1940s, Alfred Gilman and Louis S. Goodman thought of killing cancer through chemicals. They began their chemical treatment by using nitrogen mustard, which is a byproduct of the mustard gas that was used in World War I, and folic acid drugs. However, they noticed that the folic acid was a stimulant to the cancer cells, so they decided to try antifolates, because if folic acid stimulated the cancer cells, then antifolates must do the opposite. This worked, but only for a short period of time. By 1948, the cancer patients had all relapsed. So the question remains, how do you target or kill the cancer cell while sparing the normal cells? We have gotten much closer to answering this very question, but the question still remains. On the left, you can see the chemotherapy drug of choice was methotrexate. Methotrexate was effective in stopping the growth of cancer cells. In cancer patients, it stopped the growth of malignant or cancer cells to slow the progression of the disease, but it did not kill the cancer cells. Today, we use methotrexate for more than just cancer. We use it for autoimmune diseases. Ectopic pregnancies, medical abortions, and psoriasis. On the right, you can see the 1940s radiation therapy. There is a kid here. It looks like he's getting, must be treating some type of tumor he must have inside of his head. Much of the machines looked similar, but some were bigger for different parts of the body that they used it on. In this image of the doctor and the nurse administering radiation therapy to a cancer patient, the healthcare workers do not have any protective gear on. They didn't know how harmful radiation could be to them. They used this triangular tool to measure the location of the radiation exposure to the patient. Today, you will see markings, much like a grid, that are used as a focal point when taking an X-ray or giving radiation therapy. You will also see staff step out of the room, or if they have to stay in the room and help a patient or a family member maybe sit still on the table, they will have a heavy vest that protects the radiation from penetrating through and making contact with the person that has to stay in the room. This triangle that the doctor is holding, they believed that was the tool that they used to measure where to bring the machine down to. And that would tell them where the radiation exposure was going to be, and they would do this over top of the treatment site. This is an image from the 1940s, the late 1940s, when ultraviolet radiation was used as a treatment for cancer. You can see that they would all have glasses on, sunglasses, to help because the ultraviolet rays were very bright and could be blinding to them. You can see also that this is not very sanitary. They would do 4 patients at a time. They did not leave their side. They stayed by them. So not only was the patient being exposed, but the nurse was being exposed also, which we know now today that that's not very healthy for us. This is what chemo and radiation therapy looks like for today. For chemotherapy, these drugs are still very toxic and must be handled with gloves and cannot be stored next to other medications. Radiation therapy has become less invasive, and the patient is able to relax on a table and allow the machine to do the work. The healthcare worker runs the machine from outside the room and is not exposed to the radiation this way. Also, you can see that chemotherapy can be more than just oral medications. It can be IV, it can be an IV push, a piggyback, what they call a piggyback, which is like a slower drip, or like I said, oral pills also. Today, radon or radiation is considered harmful. In the 1920s, when Dr. Bailey created Radithor to be used as a medication, it was a treatment for many things. It was the cure for arthritis, headaches, cancer, digestive problems, you name it, it cured it. If you were not feeling well, go to your doctor and get an X-ray or a low dose of radiation or some Radithor. You'll be feeling better in no time. As you can see, this ad shows that it will give you relief in 15 minutes. It only costs 25 cents. Give me a dose. He can't stand that he's having a headache. So call up your doctor and get a dose of X-ray exposure. They thought radium, which is an alkaline earth metal, was so good for you. It glowed in the dark, so it must be magical. They had radioactive water. It was a big thing to have a revigator, which was a porcelain container that all houses had in them, or most houses had in them, with a large amount of water in it that was radioactive. And they would drink from this. The parents, the kids, the whole family would drink this radioactive water. They made makeup, jewelry, chocolates, snacks, treats. They even had spa centers that had radium in their supplies, in their products that they would use on you in the spa. We had radium in it. It was the cure to all things. After all, it was magical. They believed it gave them energy, so they would add it to their favorite drink and enjoy it throughout the day. That's what these gentlemen and this lady here in the center picture are doing. They're adding radium into a liquid, and they would drink that. That was their 1920s energy drink. And here's a look at what today's energy drink. You go to just about any corner store or grocery store, you will see many kinds of energy drinks. But are they really much better for us today? A lot of energy drinks have such high amounts of caffeine and sugar. They may not have radium in them, but they have other things that may not be so healthy for us. After the discovery of radium, many jobs opened for radium painters. Radium was painted onto dials in 1917 for many military equipments. This made the dials easier to see in the dark since radium glowed in the dark. Radium was painted onto watches. The ladies that were hired as painters became very ill. They were told to lick the paintbrush in between painting to bring the paintbrush to a fine point and continue painting the small numbers. While they started having pain in their jaw and holes in their jaw bone, they started having problems with their teeth. This is when they realized that radium was a big problem. Later, they called this radium jaw. When they discovered that they had holes in their jawbone from licking the paintbrushes and having all of that exposure to the radium in their mouth. In 1925, they filed a lawsuit with the United States Radium Corporation, and they won. This is the start of workers' safety that has evolved into many laws that are in place today for us to have a safe working environment. We have made much progress, but science, technology can only continue to get better as we continue to dig deeper and find more cures and preventative measures for all types of cancers. Here are a list of the images that I used. A lot of the pictures that I chose to use in my research, I got out of a lot of the articles that you will see that I cited and gave credit to. A lot of the journals and articles were very interesting and had a lot of good pictures in them. So here are some of the writing sources I used. The JSTOR, Muskegon CC site, an article I got there. Here are some from the American Cancer Society, another Memorial Sloan Kettering Cancer Center. In some of the videos, I did find some videos, YouTube videos, Bayer Global, that gave more in-depth timelines of how cancer became what we have it today and why it was so common in the 1930s from all of that radium exposure in the 1920s. Thank you for watching.